Good evening, good afternoon, and good morning. My name is Lauren Sorkin, and I'm the Acting Executive Director of the Global Resilient Cities Network. Welcome to session 24 of the Cities on the Frontline Speaker Series. Tonight, our presentation will be about healthy cities. The COVID-19 crisis has laid bare how the key determinants of a healthy city are deeply interconnected. These factors range widely from sanitation and hygiene to city financing to life expectancy. And when our cities are facing such critical budget deficits as they are today, how can we make the right investments to minimize viral exposure? And moreover, where segments of the population have major health issues, how can we ensure that people stay safe? Tonight, we're going to hear from three phenomenal women who are working on the front lines of these issues in cities around the globe. It is my pleasure to remind us of the purpose of these sessions, which is that they are for knowledge sharing. This is a practitioners network. So we ask that if you want to share any of the information that the speakers present tonight in the media, that you reach out to us and we will connect you with the speakers to get their permission. Moreover, I'll remind everyone of some of our ground rules and functionalities. We use the Q&A function in the chat at the bottom of your screen for the Q&A over the end of the presentations. And we will have, as we've had in the last few weeks, some polling questions. So take time when those pop up and answer those. We want to hear from you. And with that, it's my pleasure to turn the microphone and the screen over to Francis Gasquier, my co-host from the World Bank.
Thank you, Lauren. On behalf of the World Bank City Resilience Program, welcome everyone. This is indeed our 24 cities in the front line, and today we will zoom on the concept of healthy cities. Now, I think we all know that much of urban planning and urban policy finds its origin in public health, and so it's not surprising that the concept is in everybody's mind right now. And as Lauren said, we've identified three fantastic women who are working on the front line to present their views on the concept. Wanli Fang, she's a senior urban specialist at the World Bank. She's actually starting a broad study on what cities have been doing and could be doing to address, to be more healthy. And she will tell us a little bit about her initial findings on the different dimensions that can be considered when talking about healthy cities. Athirah Ishak, who's the Deputy CRO of Melaka, will then tell us about the current situation in her city and what they're doing in Melaka to improve public health in general. And then we were going to have Laurie Nelson, who's the CRO of the City of Boston, but we're having technical problem. And if we can't fix those technical problems, Laurie Farrel, who's the Director of North America and for Environmental Risk Management at GRCN, to step in, and she'll tell us about the situation in the city of Boston, and particularly with the equity perspective. So altogether, the presentation should take between 30 and 40 minutes, which should leave ample time for questions. Please ask your questions in the Q&A section of the WebEx. And before you ask, yes, the material and the recording of this session will be shared online. It'll be available to all. So, so without further ado, let me now turn to Wanli to start the presentation today. Wanli, the screen is yours.
Thank you, Francis. Thank you, Lauren. Thank you for having me. It's really my great pleasure to join this event. I'm still waiting for the slides to show up. Okay, great. Today my presentation has three parts. The vision, which are the key ingredients of healthy cities, and then the action, what cities have been doing to pursue this agenda, and then some reflection on the gaps and forward-looking framework. Next slide, please. Next slide, please. The slide doesn't change from my side. I hope it's changing.
Yes, Wanli, we're on slide 2. What does it take to make healthy cities? We can see that theme.
Okay, so from my side, I can only see the cover page, but it doesn't matter. Okay, I have a hard copy at hand, so I'll just go on. So a healthy city is, to me, it's a people-centric concept, because when we talk about green city, sustainable city, and livable city, we're actually referring to the physical environment, the quality of urban space. But when we talk about healthy cities, we actually are referring to the status of our residents, the people, and their quality of life. And to build a healthy city, it requires continuous effort during multiple stages, as indicated by the diagram on the right. And we noticed that there are very many guidelines, handbooks, toolkits developed to support the healthy city agenda. We found that these resources have provided very effective assistance in assessing the health city impact and planning and design and monitoring and evaluation, but less effective in terms of enabling the key stakeholders and exploring the financing modality and put those agendas under implementation. So you will see a poll question now asking you about the challenges that in your city, what challenges are you facing when you want to pursue the healthy city agenda? Please take your time to respond to this question. Next slide, please. We noticed that there are so many factors contribute to the level of health risks and the health outcomes in cities. So we group them broadly under 4 categories. The first one is natural environment and ecosystem, which normally set the broader context for healthy cities and usually requires upper-level coordination and long-term intervention beyond the urban footprint. The second category is what we call built environment and public facilities, which provide basic supporting infrastructure and public services to cultivate healthy lifestyles and could be provided and could be improved actually by the cities themselves over the short to medium run actually. The third part is the institutions, regulations, and financing, which ensure necessary actions are taken, rules are followed, the facilities are well maintained, and so on and so forth. And these could be reformed at both the national level and the city level over the medium to long run. Finally, we have the demographics and human behaviors, which reflect the interaction between the cities and the individuals that jointly shape the different health outcomes for a specific group of people, especially the vulnerable groups and poorer people in cities. Next slide, please. So in order to better understand what action has been taken so far, we reviewed about 40 dedicated healthy cities programs and initiatives by looking at their time horizon, their institutional implementing arrangement, area of focus, and results framework, achievements, and limitations. And we have some interesting initial findings. We noticed that among the various objectives of health cities, the top 3 most frequently mentioned health issues are the chronic disease, health inequality, and physical health. On the contrary, we don't see a lot of attention given to the safe working environment and active aging, which are on the right-hand side of the axis. And among the various vulnerable groups, we noticed that children and people who are physically challenged receive the most attention. And on the contrary, the lower income people are relatively underrepresented in all kinds of healthy city initiatives across countries. Next slide, please. Now I would like to dive a bit deeper into those programs by quickly go through 3 specific examples in different contexts. The first one is Healthy Chicago 2.0, which has been developed based on solid analysis of root causes, and it outlines 30 goals, 82 objectives, and over 200 strategies. I think the most impressive part is that these initiatives put much emphasis on improving health outcomes in lagging regions. On the map, on this map, you can see that the average life expectancy is much lower in the poorer areas as compared to those communities with better economic conditions. So in these lagging communities, the city are putting emphasis on 5 prioritized areas, including behavioral health, child and adolescent health, chronic and infectious disease, and reducing violence. One limitation of this program is that it doesn't specify how the city will organize among themselves to implement and coordinate, especially with so many different objectives and strategies. Next slide, please. Now I want to talk a little bit about Shanghai, which is the city with the highest life expectancy in China, about 84 years. And 2 years ago, the city unveiled its first long-term urban health vision towards 2030, and is now implementing its first 3-year action plan. And in this plan, the city prioritized 5 areas of intervention. Someone is knocking at my door. Sorry. Just excuse me. Sorry. Excuse me. I'll continue. Apologize for the inconvenience. The action plan in Shanghai actually prioritized 5 areas of intervention, which are the healthy environment, healthy society, and healthcare services, and healthy people, healthy culture, so on and so forth. And the limitation of this plan is that despite the clear designation of responsibilities, there are no details on financial schemes. And if you look at the indicators in the long-term vision and the action plan, you will notice that there's a disconnection in the M&E framework between those 2 plans. So maybe not sufficient level of coordination among people who develop those 2 plans. Finally, I want to briefly mention some effort in Africa. Actually, the Healthy Cities movement is relatively a new initiative in Africa. So we didn't find any dedicated Healthy City plans developed so far. But in this case in Tanzania, there was a program developed by a think tank, which is the first attempt at mapping the social determinants of health in the context of urbanization in Africa. And this program introduced a life course approach to identify areas of action throughout different stage of people's life, from their parental years, early years, working age, and all the way to the old age, and come up with targeted solutions. I think the limitation with this program is that it is developed by a third party, and the local government hasn't made any commitment for adoption and implementation of this initiative. Next slide, please. You can roll over to the final slide, which are the reflections I want to share. It's not changing here, but okay, I just talk. So to wrap up, I would like to share a few thoughts. So in order to achieve the Healthy Cities plan, we need a preventative upstream approach in order to, I think it is very important that we make sure people can get proper treatment when they get sick, but there are plenty of things that we can do to reduce the chance of people, to reduce the illness and injuries by building high quality urban environments and enable active lifestyle. Because of the complexity of this issue, there's urgent need to develop an integrated and implementable framework for cities to diagnose the problems, identify opportunities, develop action plans, and monitoring their progresses. As Francis mentioned earlier, the World Bank team recently launched a global initiative towards developing this kind of framework. And finally, to make changes happen on the ground, we definitely need solid institutional arrangements for planning, implementing, and financing because healthy cities requires intensive collaboration among different parties. Let me stop here and pass on to the next speaker. Thank you. Thank you to all.
Hi, and a very good evening. My name is Adira. I'm Deputy Chief President Officer of the City Council. Sorry, the slide is on. Next slide. So first of all, let me introduce about Malaysia. We is a country in Southeast Asia, separated by South China Sea into two regions, Peninsular Malaysia and Born East Malaysia. Next slide. This might be a weird figure to introduce Melaka, but yeah, Melaka is located in the southern regions of Peninsular Malaysia, and this is the overall number of positive cases in Malaysia. And you can see we have a moderate number of cases, but we are sandwiched between two high cases state. Next. So Malaysia under Prevention and Control Disease Act take action towards the pandemic with the Movement Control Order, or we can call it as MCO. And in this figure is the numbers of cases in Melaka City. Our MCO started from early March, and it was announced in short notice. And we, as a local authority, really need to act fast. As the numbers increasing day by day, tourists from all over the world, it still came to Melaka, and suddenly everything needs to be stopped. Next. So in response to the MCO announcement, our mayor made a quick decision to set up a command center for COVID-19, or we call it as CCC. As everyone else needs to stay at home, we as a local authority, we need to make sure the city is safe. Thus, the Common City Center for COVID-19 will form. So the CCC head or advisor is our mayor and assisted by our city secretary. So the team coordinator was our legal advisor. This is important as we were not familiar with the new Act, Prevention and Control Act, and it's all very new to us. Then we have our frontliner, our liaison officer, operating, health, ICT, and administration center officer. Next. So basically, each group have their own roles. Our liaison officer were the one handling the media announcement, finding the right information, and make sure the public receive the correct information. So our operation officer were the one doing all the enforcement and safety. We're going to talk about in detail on enforcement later. So our health officer, they are the one who doing the sanitizing of public space and making sure SOP compliance. So we have our IT officer using our innovation on technology to connect us with the public. And lastly, we have administration officer administrating all the financing and paperwork. Next. So the first action that we do is enforcement. We start with passing flyers of information to educate on what is happening and what we can do or we cannot do. The information is crucial at the time because we need to inform everyone and making sure that everyone following orders. Then during the second phase of MCO, we started to hand out notice to follow order. And if businesses disobey instructions, they will need to close down the business for the time being. So during the recovery movement control order enforcement, which is now, the enforcement is still actively done, but now it's only to make sure people follow the new normal. So what is the new normal? Next slide. So the new normal is we give the guideline to the public and businesses that they need to have a sanitizer, social distancing, face mask is a must, crowd limit, health screening, and disinfection schedule. Next. We also help businesses, local businesses that lose their income by developing an app called e-Bazaar. As you know, Melaka City is a tourist-centric economic city. So we're having a problem where the citizen lost, most of the citizens lost their income. So we developed this app called e-Bazaar. More than 4,000 small businesses registered to e-Bazaar to sell their product online. So other than that, we have more than 12,000 new registered as a rider to delivery service. And all the registered rider is compulsory to have health screening at MBMB. So when we launch this e-Bazaar, we get more than 14,000 search for people to use the application. Next. So we also social support in collaboration with Jabatan Kebajikan Masyarakat Melaka, Melaka Social Welfare Department, where we have done telecounseling on crisis and psychological intervention service. We have placement of homeless. All the homeless will be placed at Complex Rakam Muda Lendu, Alur Gajah Melaka, and we also distribute more than 12,000 food aid to families that in need. Next. So other than that, we disinfection public space, whereas more than 900 public spaces is being disinfected regularly, and maybe have their own schedule to regularly disinfect this public space. And then we also have 26 quarantine center during the MCO, during the early phase of MCO. We provide hotel, hostel, institute for the quarantine center. It's mainly managed by Melaka Health Department, but we as MBMB support on facilities, infra, data, and information. Next. So access to information is important. So our command center MBMB, we have digitalized all the information because we have a command center. We have CCTV dashboard monitoring. We have disaster monitoring, smart waste monitoring. We have smart map, and we have online complaints. The public can send us information or complaint that they wanted help from us, and we can read online and reply back online. So all this information is linked to My Sejahtera app. Next. So My Sejahtera app is actually an app developed by our federal government. It's a contract tracing app. Everybody needs to use this app wherever they go and scan wherever place they went. So we can do a contract tracing and locate where they going during the MCOs. So next. So My Sejahtera apps preventing and controlling the spread by contact tracing. So for now, it's 15.1 million people already registered into My Sejahtera apps. It's we can estimate as 46 of population percentage population already use My Sejahtera apps, and we already detect 33 new positive cases by the contact tracing. This is new during this end of MCO. Next. So access of information also important to the public. So our media team is really focusing on distributing information. So we do new update information every day throughout our social media. More than during the MCOs, more than 7,000 new followers in social media we had to get. So people really rely on us to give them information. So it's for making sure the public is well informed. So what we can learn from COVID-19, this is from my perspective and Melaka perspective. Next. So one is, our people are resilient. They can easily learn and grow from a shock. But the people really need support and guidance. We as a local authority are the one who's supposed to give them. Okay, next. Second one is, public trust is our most valuable asset. When the public trusts us, when we ask them to do something, they will follow because they trust us. This is why access to information is key, and people need to feel safe. Next. The third one is, prevention is better than cure. So MCO is a need. I know there is a lot of negative and impact to us, but prevention is really better than the cure. Lastly, next. So, to be honest, our environment is doing fine with us. During MCOs, our main focus is for the people. We are not enforcing on taking care of our river, and we not really focus on our tourism center attraction. But to our knowledge now, our river is more cleaner, more beautiful compared to previously when we do the cleaning ourselves. I'm going to end my slide. Next. I'm going to end my sharing session with my appreciation to our CCCT. They are the backbone during our MCO, working hard day and night, making sure that we get some of a semblance of normal back. Thank you for Melaka.
And thank you very much. My name is Farrel. I will be presenting on behalf of Lori Nelson, who is the CRO for the City of Boston. Lori sends her regrets. As you heard, we've had some technical difficulties this morning, and so I will do my best to present her information to the best of my knowledge. However, she is available and welcomes any of you to reach out to her for more information after this presentation if you
would like. And her contact information is available on this title slide here. And so Lori has been at the forefront of equity discussions across the network and has provided us with her expertise and leadership on this topic. And it's wonderful to learn about how Boston is using their work on equity to create a healthy city. So first, let me set the stage for you about the city of Boston. It's important when we talk about Boston to understand how much the city has embraced the need to become an equitable city in everything that they do. When they first started their journey to create a resilient strategy, they understood that they could not become a resilient city unless they addressed the persistent racial inequities that were a part of their city. Because of that, Boston has become an exemplar for equity across our network. Previously, there was a network exchange held on equity in Boston, and 4 strategic approaches that reinforced the same principles of healthy cities that Wanli was speaking about were adopted by the city coming out of that leadership exchange. The first is that leadership within the city must set the tone to acknowledge trauma faced by marginalized communities. Second, embedding equitable decision-making tools in key city processes is necessary to become healthy. Third, the city recognized the importance of co-creating with community to achieve tangible, equitable, and resilient outcomes. And finally, they understood the need to integrate data and the historical context of their city and of the data into any analysis and decision-making that would be undertaken. Today in Boston, they, as we all are managing through these difficult times of the pandemic. We wanted to give you a snapshot of where they stand, where their status is at the pandemic today. So as of August 2020, the city has experienced just over 11,000 cases of COVID and have unfortunately had 551 losses of life due to the pandemic. The pandemic, as we all know, has laid bare the inequities in cities, and Boston is no stranger to that. They have experienced a higher rate of positive tests among their Black and Brown communities, and also a disproportionately high number of deaths among their Black and Brown communities as well, although they have also had a high number of deaths among their white population. So in order to respond to the pandemic, and I should say that the Boston presentation is really going to focus on some of the institutional practices that a city can take to respond to a pandemic, but also to maintain a healthy city or to create a healthy city. And so I'm going to highlight 4 examples of undertakings that Boston has that will set them up to become a healthy city. The first is an executive order that they created in January 2019, Health Inequities Task Force, created in response to the pandemic, a letter to the State Advisory Board, and then a series of equity town halls. So I'll just touch briefly on each of those. 2 years ago, Boston established an executive order on equity, race, and inclusion. And the executive order signed by Mayor Walsh really highlighted the city's seriousness and understanding that inclusion had to be part of any work done by the city. Inclusion had to be not only forward-facing, but internal as well. So any activities undertaken by the city would be following the intention of the executive order. When the pandemic hit, because the city had already set up this practice and this culture, it was a logical next step for them then to establish a health inequities task force. This task force was made up of stakeholders and leadership within the city and outside of the city. Over 20 participants were a part of the task force. And they were tasked with looking at the daily data of the pandemic, they were called on to give their priorities as well as to look at the data from an equity lens, through an equity lens, and from there come up with plans for reopening of the city. And so the idea of really fully embracing the inequities in the city while developing the plans is what really set Boston apart from some other cities in their pandemic response. Mayor Walsh also declared racism as a public health crisis. And coming out of the task force developed a letter to the State Advisory Board for Pandemic and recommended a number of actions that the state should be taking to make sure that we have an equitable response to the pandemic. I won't go into the letter, but the link, if you would like to read it, is provided on this slide, as well as the executive order from Mayor Walsh declaring racism an emergency public health crisis. The letter, however, touches on highlights three main areas where the task force identified the state should be thinking about: testing and tracing, quarantine and isolation space, recognizing that housing for the homeless and issues with dense housing need to be addressed if we're going to have a healthy city. And they also requested more work, more attention to transportation access. As I mentioned, the final initiative is the Equity Town Hall, or are the Equity Town Halls. So the city recognized that Black and Brown and immigrant populations are most often not at the table when decisions are being made. But they knew that their voices needed to be heard during the reopening process if they were going to be successful and to be resilient. And so the city was very intentional in including their entire population in the discussion and really listening and incorporating the ideas that they heard during those town halls into their planning, into their plans. And so Laurie's provided the next two slides that speak to some of the details of what they heard coming out of those three processes that I just highlighted. Again, I won't go into all of the details, but there are some very tangible specifics that are to be shared, to be learned from, and Laurie would be happy to go into details with you on these if you're interested. And they're here for you to read. But all this to say that it's not just about talking or creating policies, but it is about getting to tangible actions on the ground that actually make a difference and have an impact. So there is also a reopening strategy that's been prepared based on some of the discussions. The priorities, and I do apologize, I think my lawn is being cut now. We're having a funny day for technology today. We're having, the city has created a plan for reopening. At the heart of the plan, they've identified 3 priorities, and these are the core priorities that must affect any activities that are undertaken. The first, of course, is that the city priority is to protect lives. They also want to have an intentional focus on the needs of the most vulnerable residents. And finally, to maintain a long-term competitive advantage, they need to build on Boston's history as one of the best places to work and live. And finally, I'll just mention quickly that the City of Boston has created a Resiliency Fund. And when you look at the criteria that are applied to administering the fund, you can see how equity and healthy cities are top of mind in everything that the city has done, and the consistency with this intention is clear. They're applying a lens of equity to all of the work that is undertaken coming out of the fund, and really having a focus on the populations that include elders and children, homelessness, people with homelessness, people with disabilities, first responders, a number of others. But again, I think the message here from the city of Boston is that when you set the tone at the highest level of leadership, that equity, healthy cities, that resilience is your intention, and you follow through on that intention with every action and every activity, then you have the ability to achieve success and the positive outcomes for your residents. And I will leave it there. I want to thank you on behalf of Lori for the opportunity to present Boston's Healthy City Journey.
Thank you very much, Wanli. Thank you, Lorian, and thank you, City, for these very interesting presentations. We are having problem with technology today, but also some emergency. Unfortunately, Wanli has had to leave us because of a family emergency. In fact, someone was knocking on her door to tell her about it. So, Lorian and Didi, the questions are going to go to you. Hopefully, you can answer. We have quite a few questions in the Q&A section. I think the first one is to ask comes from Roy Lego, who's asking if you've looked in particular places, what other initiative you've learned from to support your program, and which one would you recommend that people look at, particular initiative documents and programs around the world, in the US or in Malaysia in particular. So maybe we can start with you, Lorian, and then we'll go to Dili.
To Athirah, just a quick clarification.
Athirah, yes. Thank you, Francis. Yes, healthy cities are being embraced by a number of our cities, and I can only speak to the North America region, but the city of Vancouver has a very comprehensive plan on healthy cities, and also the city of Montreal has been doing quite a bit of work on healthy cities as well, just to name a couple. So I would recommend looking into those city plans.
Athirah, are you able to see us and hear us? This is a kind of mysterious night for technology and connecting. And if you want to come back to the question, we can do that. In the meantime, let me pose another question to you, Lorian. We've seen a lot of different initiatives, and this question actually is coming from Sumit Agarwal, and also, if we are able to unmute and see you again, Athirah, a question from Loy Rego is also related, and that is around what's been the most successful in getting people to change their behavior to help to support healthy cities. And this, in some way, it seems like a very multi-tiered question, because Lori's presentation touched on behavior change at an institutional level. It touched upon it at a more project level and a decision-making level. So there might be a little bit for you to unpack, Lorian, and then hopefully we'll be able to see Athirah as well and hear from her.
Right. Thank you for the question. It is a very loaded question. Behavioral change, if we could unlock the key to that, we would be able to solve so many of our world problems. I believe in Boston, what really kickstarted the change is the champion at the mayor's level. And so it's really important to have leadership at the highest levels of your institutions, and that obviously unlocks a lot of things that can flow from there. But that's not always possible or always the most effective either. What we found is that when you can speak to people's hearts, then you will see change. You have to show people how the proposed change will actually not just impact them, but their loved ones and their families and make their lives better. And so that taking a chance on making that change, although it may seem difficult at the beginning, once you get through it, you will all benefit from it. Unfortunately, through this pandemic, that hasn't been a hard thing to show people how it is affecting everybody individually in their homes. But we can take this moment to, I don't want to say capitalize because that seems very opportunistic, but we can take this moment to show how things can be improved and small actions can make a big difference. So at the institutional level, the executive order, definitely a very hard-hitting tool that is available for cities to enact change, especially in institutions that have been around for 100+ years and entrenched in their ways. An executive order from leadership really goes a long way to unlock some of the processes that have been stuck in the old way of thinking. But at the more individual level, the town halls, where you show the community that you are there for them and willing to listen to them and hear their voices, is, I think, even on par, if not more effective than the institutional actions. Because when you see people, when people feel that they are being heard and listened to, and then they see action taking place as a result of that, then you will also see those individuals taking their own actions toward creating healthy cities. And that's a very kind of vague, nebulous response, but it comes down to simple things like, am I going to walk to my destination or take my car? If you feel that you're part of a greater system that is also working toward an outcome of a healthy city, you might say, yes, I'm going to do my part. I will make those healthy choices.
Sorry. For the first question, I think healthy city in Malaysia. I think I only can speak for Malaysia. Actually, my baby is up. That's why. So most of our plans really embedded in our local plan. So each cities in Malaysia, each states in Malaysia, we have our comprehensive local plans. For Melaka City, we have a very comprehensive local plan where we embedded SDG, we have embedded resilience and others. So that consists of healthy city. So other than Melaka, I would suggest maybe Shah Alam Selangor, or we really look at Singapore for our neighboring country. That's my answer. I'm sorry I did not catch for the second question, but I heard about from Lauren regarding the public knows information. That is very crucial for Melaka City also. During MCO, everybody is questioning what happened and what they need to do. When they did not know information or what happened, they will act differently. So that's why we provide information, we provide data, so they will understand, they can trust us, and everything works smoothly. That is my comment. Thanks.
Thank you very much, Athirah. These were actually very, very good answers. Lorian, the next question is really for you, since you're responsible for risk management at GRCN. Obviously, and hopefully we will deal with this pandemic, but really the big challenge will be to avoid future pandemics. What do you think, from what we're learning now, will we be able to use, and how will it influence how the city of Boston and other cities in the US are being managed? And once you're done, I'm also quite curious to hear City's view on that question.
Francis, is the question, how will we avoid future pandemics? Or is it, how do we prepare for future pandemics? Or should I speak to both? I'm not quite sure I heard the beginning.
Francis, you're on mute. Is it a tech issue?
I think now I'm back.
There you are, you're back.
The question is not so much how do we prepare. I think now we've learned a lot about how to prepare, but how do we avoid in the first place? How do we build an environment and a society that is able to, I mean, we won't avoid all pandemic, but we can probably avoid quite a few of the potential future contamination in the future.
Well, I think that it's probably not the way we should be approaching the future. I don't think we can avoid pandemics. I think we can reduce the spread of pandemics. We can reduce the number potentially of pandemics. And I won't speak to that specifically because I think that's an epidemiology question that I'm not an expert in. So I don't want to make too many assumptions. But from a risk management perspective, I can say that we should be preparing for all shocks and stresses. And it's a resilience perspective as well. And we don't know what's coming in the future. I used to work in flood management before I joined the resilience world. And we would always pick our worst case storm and prepare for that and plan around that. But I was always very aware of the fact that we were never going to get that storm again. We were going to get a different storm. And so while we had prepared for the worst case, the storm that we knew of, the storm that we were going to get would be unknown. And we would have to just be ready to adapt and be resilient in whatever form that took. And so I think for the individual and for cities, the best thing that you can do is to make your residents and your homes resilient, meaning that you have everything in place that you need, that you can think of to be ready. So if that's having stockpiles of food or medicine or a phone tree, or to call your relatives and your friends to check on them, if it's having a backup generator, in terms of health, it's making yourself as healthy today as you can. Go for a walk, eat healthy food, do everything you can so that your own personal vessel is ready to respond to an invasion of a disease, of a pandemic. That's at an individual level. At an institutional level, obviously there are systems that we can support in science, in communications and travel to help reduce the spread of the virus. Again, I won't get into too specific about the pandemic issues itself because that's beyond my expertise. But I think what the basic tenet is that in risk management, you prepare for the unknown by creating an environment that is as strong as you can imagine it needs to be. And then you also prepare to be mentally and physically resilient to whatever comes.
Thanks, Lorian. And just a quick question to transition that to something that perhaps Athirah could comment on from her perspective. Thinking about what Lorian said and how we're not preparing for the last disaster or pandemic or flood, but we're trying to look at that integrated resilience approach. Has it changed the way that MBMB is thinking about the next set of risk management plans? What do you see as some of the most powerful lessons that Melaka has taken from the Healthy City approach? And hello to your beautiful baby.
So sorry, she's up and she's active. So I would like to share maybe a bit during our PRA, we're collecting all the issues in Melaka to develop our resilience strategy. One of the question is what happens if there is a disease outbreak from the tourists that came to Melaka, because we have 16 billion tourists each year. So when we asked our health department, they said that there's not much disease from the tourists and it's okay. There's nothing. It's not a risk. So okay, we shift our focus to something else, not these tourists. So that's the thing. Maybe we think we being prepared, but we never know what will happen. So I really agree with Lawrence that it's the most important thing is the system itself is resilient. The people itself resilient. We may need some set of action. If something happens, what next? First thing we need to do, second, third, and fourth. Maybe sets of actions, maybe a template for each shock or disaster that happened to us. Yep.
Thank you, Athirah. Thank you for being so generous with your time. I think, as everyone knows, working from home has its benefits and also its challenges. And we appreciate you making the time and sharing with us excellent reflections on the processes and steps to put in place, no matter what the challenge. And I think this has been, despite a few technical difficulties, a wonderful session that I will now bring to a close by really thanking you, Lorianne, for stepping in, and thanking Lori for preparing the presentation. Thank you, Athirah, for sharing from Melaka. And thanks to Wanli, who we'll follow up with after hopefully everything is okay and everyone is safe and well on her side. Next week, we will be back at the same time with Cities on the Front Line with a focus on urban density. There were a number of questions actually in the chat about safe distancing, and so we will dive deeper into those issues next week. Thank you for joining us on behalf of GRCN and the World Bank. We appreciate you being here and hope you'll join us again next week. Stay safe and stay healthy.